I would say that it was really my interest in medicine, along with my interest in understanding the areas of hereditary diseases that interested me the most. I'm a pediatrician as well as a medical geneticist, so my typical patient population are primarily children, but my current interest is taking care of patients who have what we call inborn errors of metabolism or metabolic disease. And in Michigan, we're the primary management center for those individuals from birth through adulthood. And so if they need medical management through adulthood, we're also taking care of those adults. My typical day is probably a little bit unusual compared to many other geneticists. I'm involved in really three main different areas of genetics. I do a lot of education and teaching in the medical school itself. So our residency program, our genetic counseling training program, graduate students, I'm involved in teaching and education for them. I also direct one of the clinical genetics laboratories, the molecular genetics laboratory, so I spend a fair amount of my time in the laboratory itself, analyzing test results and signing out reports as it relates to patients who are being tested for various genetic diseases. And then the third part of what I do is the clinical care and patient management and seeing patients in clinics. So I divide my time up most every day into those three areas. One of the things about genetics is that you're able to balance both your personal life as well as your work life and be able to have both aspects of those in context to what you're doing. If you're in this specialty and you're not interested and enthusiastic about genetics, you're in the wrong field, or you shouldn't be in this field. In this century, genetics has evolved rapidly, well beyond what any of us would have predicted years ago, and the opportunities to understand disease will only strengthen over the next 10 years, and that this is really the place to be if you want to be at the forefront of medicine. Our residents have lots of exposure to all aspects of genetics. They rotate through clinics in cancer genetics, neurology genetics, reproductive genetics, pediatric genetics, metabolic genetics. So our residents actually have a wide, varied clinical exposure to all different types of patients, from newborns to adults with those various disorders. And they also spend time in the various genetics laboratories learning about the other side of genetics in terms of the tests that they order and how those tests are performed and how those tests are interpreted. And then our residents have time for research as well, and they're allowed to choose a project and pick a mentor and utilize their research time to develop that project. So I think those are the three main components of what a training program involves. The best part of the job, I would say, for me, is being involved in the education and training of such individuals in an area where genetics is part of everyday management for every single genetic or common disease that affects all of us. And so the idea of being able to be a part of medical management and utilize the skills that we've learned is really what interests me, and that's what I talk to trainees about. Trainees have the opportunity not only to help with the diagnosis, management, and treatment of patients, but really I think there's opportunities for them to develop their interest and develop some research ideas that can lead them to areas for their future career. So I think trainees have lots of opportunities to understand not only classical genetics, but be in a position as genetics is changing and the more we understand about genetics, that they'll be in a position to be the leaders for the future. The beginnings of what's happening in genetics are going to lead to revolutionary changes in the management of lots of different diseases, common diseases, rare diseases, and that if you want to be in a position where you're able to be involved in such an area, that this is where you want to be, and that other specialties won't lead you down that route and give you that kind of opportunity. My training was a little bit unusual. I did a PhD first in genetics before I went to medical school. And one of the most gratifying things to me was during my research training, when we were in the laboratory and identified a particular new disorder that helped lead to the development of a new test for diagnosing a particular genetic disease. And so I think that was a particular moment that always stands out in my mind.